In the winter of 1846, a man named Horace Wells sat in a dentist's chair in Hartford, Connecticut, and inhaled a gas that made him laugh. When he woke up, his tooth had been pulled. He felt nothing. He walked out of that room convinced he had found something the world needed, a way to remove pain from surgery entirely. He spent the next year trying to prove it. By 1847, the U.S. government had moved to suppress the entire class of practitioners he belonged to. Not quacks, not fraudsters. Practitioners with documented results, trained methods, and a tradition stretching back centuries. The question worth asking is simple enough. They were stopped. We know that. What we don't know, and what this video is about, is why. To understand what was banned, you have to understand the world it existed in. In the 1800s, medicine in America was not a single organized profession. It was a landscape. Dozens of competing schools of thought operated openly, some university-trained, some passed down through apprenticeship, some rooted in traditions imported from Europe, and others native to the American continent itself. There was no federal licensing system, no single accrediting body. A man in Ohio could hang a shingle and call himself a physician with nothing more than a self-printed certificate and a confident handshake. This was not unusual. This was normal. Within this landscape, 3 schools of alternative medicine had grown substantial followings by the 1840s: the Thomsonians, the homeopaths, and the eclectics. Each had its own theory of the body. Each had its own tools. And each had its own reason to distrust the orthodox physicians, who were increasingly calling themselves the only legitimate practitioners of medicine. The orthodox practitioners had a name for themselves by mid-century. They would eventually become what we now call the American Medical Association, founded in 1847, the same year the suppression began. That timing is not incidental, and we'll come back to it. But to understand the conflict, you need to spend time in the world of the people being pushed out. What they practiced was not guesswork. It was a system. And some of what they knew, we are still rediscovering today. Samuel Thomson was born in New Hampshire in 1769 and grew up largely outside the reach of formal education. His mother died when he was young, under the care of orthodox physicians whose treatments, bleeding, purging with mercury compounds, application of arsenic-based preparations, left him suspicious of the entire enterprise. He was right to be suspicious. The orthodox medicine of the early 1800s routinely used calomel, a mercury chloride compound, as a standard treatment for everything from fevers to intestinal infections. The doses were often high enough to cause mercury poisoning. Patients lost teeth, some lost sections of their jaw. A few died from the cure. Thomson developed his own system around a single idea, that all disease came from cold, and that heat was the natural healing force of the body. His method centered on botanical treatments: Lobelia inflata as an emetic to clear the stomach, cayenne to restore circulation, steam baths to raise body temperature, and herbal preparations of bayberry, sumac, and slippery elm to support recovery. He patented his system in 1813 and sold family licenses for $20 each, a significant sum at the time, roughly a week's wages for a laborer. By the 1830s, an estimated 3 to 4 million Americans were using the Thomsonians system. In some rural regions, particularly in the South and Midwest, where licensed physicians were scarce, it was not an alternative to medicine. It was the primary medicine. Thomson's followers held conventions, published newspapers, and lobbied state legislatures to keep medical licensing laws off the books, arguing that government-mandated licensing was a monopoly that would strip ordinary people of the right to treat their own families. Thomson was not entirely wrong about what he opposed, and that complicates the story. The orthodox physicians of his era were, in documented cases, doing measurable harm with heavy metal compounds and aggressive bloodletting, practices that would be considered malpractice today. The Thomsonians faded as a unified movement after Thomson's death in 1843, but their botanical tradition fed directly into what became the eclectic school, and their political battles set the stage for what was coming. Homeopathy arrived in America from Germany, brought by physicians who had trained under or read the work of Samuel Hahnemann, a German doctor who developed the system after becoming disillusioned with the medicine of his own era. Hahnemann's core principle was this: substances that cause symptoms in a healthy person can cure those same symptoms in a sick person. He called it similia similibus curentur, meaning like cures like. His second principle was equally controversial. Remedies became more potent, not less, as they were diluted. He called this the law of infinitesimals. A substance diluted to the point where no original molecules remained was, in his view, more effective than the undiluted form. This is the point where many modern listeners check out, and that skepticism is reasonable. There is no accepted molecular mechanism by which Hahnemann's dilution theory works. That much is true. What is also true, and considerably less discussed, is that homeopathic treatment in the 19th century had measurably better survival rates in certain epidemics than orthodox treatment. Not in theory, in documented records. During the cholera epidemic of 1832, a Cincinnati homeopathic physician named Dr. John Wheeler reported a patient mortality rate of approximately 3%. The Orthodox hospital in the same city reported mortality rates between 40 and 70%. The historians who have studied these records point to a straightforward explanation. Homeopathic treatment at the time largely meant rest, gentle supportive care, and the avoidance of aggressive interventions. The comparison was not homeopathic remedies versus orthodox medicine. It was, effectively, rest versus mercury and bleeding. The patient who received no aggressive treatment often survived longer than the patient who did. By the 1840s, homeopathy had become the fastest-growing medical sect in the United States. Its practitioners were often university-trained physicians who had formally converted, men with credentials and patient bases. They founded the American Institute of Homeopathy in 1844, 3 years before the American Medical Association came into existence. The AMA's founding documents explicitly named the suppression of homeopathy as an organizational priority. Members were initially prohibited from consulting with homeopathic physicians professionally. Those who did could face expulsion. That is not interpretation, it is in the record. But homeopathy was only one part of what was being pushed out. The eclectics and what they carried are the part of this story that almost nobody has heard. Before we get to the eclectics, consider this. 3 of the plant compounds they documented and used in the 1840s are still active ingredients in FDA-approved pharmaceuticals today. Nobody suppressed the plants. They suppressed the people who knew how to use them. The eclectic physicians were the most formally organized of the alternative schools. Founded in Cincinnati in 1845 by Dr. Worcester Beach and others, the eclectic school was built on a specific intellectual position. Take what works from any tradition, discard what doesn't, and rely on direct observation over inherited theory. Their name came from that principle. Eclectic, from the Greek, means to select from multiple sources. They built the Eclectic Medical College in Cincinnati in 1845. Full curriculum, clinical training, graduation requirements. Their graduates were not self-taught herbalists. They were trained physicians who had simply chosen a different pharmacopoeia, and their pharmacopoeia was built almost entirely on North American plants, many of them documented from indigenous healing traditions. Echinacea for immune support, black cohosh for menstrual and menopausal conditions, golden seal as an antimicrobial, bloodroot as an escharotic, a compound that causes controlled tissue destruction, used for certain skin lesions. These were not folk superstitions. The eclectics conducted systematic clinical observations by the standards of their era. They published case records. They tracked outcomes. Their flagship journal, the Eclectic Medical Journal, ran from 1849 through 1919. 70 years of clinical documentation. The documentation is worth sitting with. The eclectics identified and described the therapeutic uses of echinacea in the 1880s. The compound would not appear in mainstream pharmacological research until the 1970s, and it is now one of the top-selling botanical supplements in the world. Black cohosh, which eclectic physicians use specifically for menstrual irregularities and menopausal symptoms, is today the subject of active clinical trials. The National Institutes of Health has funded research into its mechanisms. The compound actine, isolated from black cohosh, shows measurable effects on certain hormone receptors. Golden seal contains berberine. Berberine has been studied extensively for its antimicrobial and metabolic effects. It is currently in Phase 2 and Phase 3 clinical trials for type 2 diabetes management. The eclectics did not invent these plants. Indigenous peoples across North America had used many of them for centuries. What the eclectics did was document them systematically, train physicians to use them in clinical settings, and build an institutional structure capable of transmitting that knowledge forward. That institutional structure was methodically dismantled over the following decades. The last eclectic medical school closed in 1939, not because of a scientific disproof of their methods, because of something considerably more pragmatic. The American Medical Association was founded in Philadelphia in May of 1847. Its stated purposes included raising educational standards for physicians, improving public health, and advancing the science of medicine. These were legitimate goals. What is also documented is that the AMA from its founding pursued a second, less stated agenda, consolidating the practice of medicine under orthodox physicians and systematically removing alternative practitioners from public legitimacy. The mechanisms were legal, educational, and economic. They worked over decades rather than overnight. The first mechanism was licensing. State by state, the AMA and affiliated medical societies pushed for licensing laws that required practitioners to hold degrees from AMA-approved schools. Since the AMA did not approve eclectic, homeopathic, or Thomsonian institutions, their graduates could be, and eventually were, excluded from legal practice in state after state. The second mechanism was the Flexner Report of 1910. Abraham Flexner was an education reformer, not a physician, commissioned by the Carnegie Foundation to survey American medical schools. His report rated schools on their laboratory facilities, full-time faculty, and alignment with German research university standards. The eclectic schools scored poorly by these metrics, not because their clinical outcomes were poor. The report did not measure outcomes. It measured facilities and organizational structure. Following the Flexner Report, funding from Carnegie and Rockefeller foundations flowed almost exclusively to orthodox, research model medical schools. Schools that could not compete for that funding closed. The eclectic, homeopathic, and Thomsonian schools closed in sequence over the following 3 decades. The third mechanism was social. The AMA's Code of Ethics initially prohibited member physicians from consulting with homeopathic or eclectic practitioners in any professional capacity. A physician who consulted with an eclectic colleague, even informally, could face expulsion from local and national medical societies. Without society membership, a physician struggled to get hospital privileges. Without hospital privileges, a practice could not survive. This was not persecution in the dramatic sense. There were no arrests, no public burnings, no dramatic confrontations. It was exclusion by paperwork, by funding decisions, by the quiet withdrawal of professional legitimacy. The eclectics formally dissolved in 1939 when the last of their schools, the Eclectic Medical College of Cincinnati, closed. Their library, 70 years of clinical journals, case records, botanical monographs, was partially preserved. Much was lost. Knowledge is harder to suppress than institutions. The eclectic pharmacopoeia did not disappear when the schools closed. It dispersed. Some of it went into the eclectic's own published works. John King's American Dispensatory, first published in 1852 and revised through multiple editions, remained in print and was used by herbal practitioners throughout the 20th century. Some of it survived in indigenous communities, which had held much of this botanical knowledge long before the eclectics documented it formally. Some of it fed into the naturopathic medicine movement, which organized in the early 20th century and preserved significant portions of the eclectic and Thomsonian botanical traditions. And some of it was rediscovered independently by pharmaceutical researchers who, starting in the 1970s, began looking at North American botanicals with the tools of modern chemistry. Echinacea was re-examined in Germany in the 1970s, where it became one of the most studied botanicals in European phytomedicine research. By the 1990s, it was being widely sold in the United States again. Berberine, the active compound in golden seal, has accumulated over 3,000 published studies since the 1970s. Its effects on blood glucose regulation, antimicrobial activity, and cardiovascular function are areas of active research. Multiple clinical trials are currently ongoing. Black cohosh is approved in Germany by the Commission E, the equivalent of the FDA's botanical advisory body, for the treatment of menopausal symptoms. It is among the top-selling botanical supplements in the United States and Europe. The eclectics were right about these plants, not in the metaphysical sense, in the measurable, pharmacologically verified sense. They were right before the tools existed to confirm it. And when the tools did exist, the confirming was done without credit. No acknowledgement that a school of practitioners had documented these findings a century earlier, had built clinical records around them, and had been dismantled before those records could inform the next generation of researchers. This is not a story about heroes and villains, though the narrative shape invites that reading. The founders of the AMA were not corrupt men acting in bad faith. Abraham Flexner was not a mercenary. The move towards standardized education and laboratory-based medicine produced real improvements, including the reduction of surgical mortality, the germ theory of disease, and the development of antibiotics. These were genuine advances, but standardization always has a cost. When you build a single road, you close the paths that ran alongside it. When you centralize knowledge production, you create a gap where peripheral knowledge used to live. And when the peripheral knowledge happened to be correct about things the central system hadn't yet examined, as the eclectic pharmacopoeia demonstrably was, that loss is not trivial. The question this history asks is not whether orthodox medicine was wrong to organize. It is whether the suppression of competing traditions was necessary to that organization, or whether it was simply convenient. The AMA's early prohibition on consulting with alternative practitioners was not a scientific policy. It was a competitive one. That distinction matters. The eclectic physicians were not practicing in contradiction to the science of their era. They were practicing in the absence of it. Before clinical trials existed, before randomized controlled methodology was developed, before the tools to verify or disprove their methods were available to anyone, what was suppressed was not disproven. It was excluded before the disproving or the proving could happen. That is a different thing. The Thomsonians, the homeopaths, and the eclectics were not the same. Their methods differed, their results differed, and their intellectual honesty differed. Grouping them as simply alternative medicines loses that nuance. But what they shared was this: they were practicing before the gates were built. And when the gates went up, they were left outside, not because a scientific verdict had been rendered, because an institutional one had. The plants they documented are still here. The conditions they treated are still here. The question of what we lost and how much of it we are slowly finding again is one historians, pharmacologists, and physicians are still working through.